Vaccines are one of the greatest public health achievements. They have saved countless lives and drastically reduced the burden of infectious diseases. From smallpox to polio, vaccines have protected us from deadly threats. They work by triggering the body's natural defenses, preparing it to fight off specific viruses and bacteria. Vaccines contain weakened or inactive parts of a virus or bacteria. When introduced into the body, the immune system recognizes these foreign invaders. It then builds up defenses like antibodies to fight them off. This creates immunological memory. If a vaccinated person encounters the real virus or bacteria later, their immune system is ready to attack. The impact of vaccines extends beyond individual protection. They contribute to something called herd immunity. When a significant portion of a population is vaccinated, it becomes harder for a disease to spread. This protects those who cannot be vaccinated, like newborns, or people with weakened immune systems. Vaccines undergo rigorous testing before they are made available to the public. They are monitored for safety and effectiveness. The benefits of vaccination far outweigh the risks. It's important to rely on credible sources of information about vaccines, such as healthcare providers and public health organizations. The vaccine-autism myth can be traced back to a single, deeply flawed study published in 1998. This study, led by Andrew Wakefield, suggested a link between the MMR vaccine and autism. The MMR vaccine protects against measles, mumps, and rubella. Wakefield's study was small and poorly designed, with numerous ethical violations. It was later retracted by the medical journal that originally published it. Wakefield himself lost his medical license due to his unethical conduct. Despite its retraction and complete discrediting, the study sparked widespread fear and mistrust of vaccines. The timing of the study coincided with a growing awareness of autism. This led some parents to believe there might be a connection. The study's findings were widely publicized and sensationalized by the media. This contributed to the rapid spread of the myth. The emotional appeal of the story, combined with a lack of scientific literacy among the general public, made it difficult to counter the misinformation. The scientific community was quick to criticize and debunk Wakefield's flawed study. Numerous large-scale, well-designed studies have since been conducted, all failing to find any link between vaccines and autism. These studies have involved millions of children worldwide. They have been rigorously reviewed by independent experts. The evidence is overwhelming. Vaccines do not cause autism. Scientific organizations like the Centers for Disease Control and Prevention, the World Health Organization, and the Institute of Medicine have all issued statements refuting the vaccine-autism link. These organizations are at the forefront of public health research, and their conclusions are based on the most robust scientific evidence available. The scientific consensus is clear. There is no evidence to support the claim that vaccines cause autism. This myth has been thoroughly debunked by the scientific community. The weight of evidence against it is overwhelming. The vaccine-autism myth has had a significant and harmful impact on public health. Misinformation about vaccines has led to a decline in vaccination rates, putting communities at risk. When fewer people are vaccinated, herd immunity weakens. This makes it easier for preventable diseases to spread. We have seen resurgences of diseases like measles, mumps, and whooping cough in recent years, largely due to misinformation and vaccine hesitancy. These outbreaks are not just statistics. They represent real people, often children, suffering from serious and preventable illnesses. Some outbreaks have resulted in hospitalizations and even deaths. The decision to vaccinate is not just a personal one. It's a public health issue with far-reaching consequences. Choosing to vaccinate helps protect not only ourselves, but also our communities, especially those who are most vulnerable. Section 5. Fighting Back, Promoting Science Literacy and Trust in Healthcare. Combating misinformation about vaccines requires a multi-pronged approach. One crucial aspect is promoting science literacy and critical thinking skills. We need to equip people with the tools to evaluate information objectively. This includes understanding how scientific studies are conducted, how to identify credible sources of information, and how to recognize misinformation and disinformation. Another key strategy is fostering trust in healthcare professionals. Doctors, nurses, and other healthcare providers play a vital role in providing accurate and evidence-based information about vaccines. Open and honest communication between healthcare providers and patients is essential. Patients should feel comfortable asking questions and expressing their concerns. Healthcare providers should be prepared to address these concerns with empathy and patience. Section 6. The power of community. Sharing accurate information. Combating vaccine misinformation is not just the responsibility of healthcare professionals and scientists. It requires a collective effort from individuals, communities, and society as a whole. We all have a role to play in sharing accurate information about vaccines. We can start by educating ourselves about vaccines from reliable sources, such as the CDC, the WHO, and reputable medical journals. We can then share this information with our friends, family, and social networks. When we encounter misinformation, we can politely correct it and provide accurate sources. Social media platforms also have a responsibility to combat the spread of misinformation. They can do this by flagging or removing false content, promoting accurate information from trusted sources, and working with public health experts to develop effective strategies. Section 7. A shared responsibility, protecting ourselves and our communities. Vaccines are one of the safest and most effective public health interventions ever developed. They have saved millions of lives and continue to protect us from serious diseases. The decision to vaccinate is a personal one, but it has far-reaching consequences. By choosing to vaccinate, we are not only protecting ourselves, but also our communities, especially those who are most vulnerable. We must base our health decisions on scientific evidence and reliable sources of information. It's important to be critical of what we see and hear, especially online. We should consult with trusted healthcare professionals to get accurate information about vaccines. By working together, we can overcome misinformation, protect public health, and ensure a healthier future for all. Section 8. Conclusion. Vaccines, facts, and a healthier future. Vaccines are a testament to human ingenuity and our ability to overcome health threats through scientific advancements. They are a cornerstone of public health and a key to a healthier future. The vaccine-autism myth, though thoroughly debunked, serves as a stark reminder of the dangers of misinformation. We must remain vigilant in combating false claims and promoting evidence-based information. By embracing scientific literacy, trusting healthcare professionals, and sharing accurate information, we can protect ourselves and our communities from vaccine-preventable diseases. The facts are clear. Vaccines save lives. Let's choose science, choose facts, and choose to protect ourselves and future generations. If you found this video informative, please comment below with your thoughts, subscribe to our channel, and hit the notification bell to stay updated with our latest content.